So, so good morning or good afternoon, everyone, and welcome to our community conversation. Um, and this one is to celebrate Native American Heritage Month. Community conversations go on regularly, so we encourage you to join our listserv, find out when these are occurring, and so you can join us for these. Today, we have a special guest. Matthew Waits is the Health Center Diabetes Prevention Program Manager at the Prairie Band Potawatomi Health Center. And more recently, he has been serving as one of the COVID-19 go-to resources. Matthew earned an Associates of Arts from both Oklahoma State University and Haskell Indian Nations University, and a Bachelor of Science from Washburn University, and a Master of Science from Arizona State University. Mr. Waits is here to speak to us today on the impact of COVID-19 in the Native American community, as well as some other areas of interest that he has related to health and wellness. So without any further ado, uh, go ahead, Matthew, the microphone is yours.
Awesome. Well, thank you so much for the great introduction, Kelly. OCO, Bojo, that's the greeting in my native tongue, Cherokee, and the PBPN greeting to say hello. Today, we're going to talk about something you might not have seen in the news or on social media lately. It's COVID-19, and more importantly, the effects that it has had on Native American communities. Just like Kimberly stated, my name is Matthew. I'm the coordinator of the Diabetes Prevention Program here at Prairie Band Potawatomi Nation. We serve 336 patients dealing with type 1, type 2, gestational, pre-diabetes from ages 5 to 85. Now, 336 patients doesn't seem like a lot, but here on the Prairie Band Potawatomi Reservation, it's only 11 by 11 miles and serve about 12 to 1,500 live in this area. So that's actually a big number. Sorry if I seem out of breath, I'm on a treadmill. And with COVID, really haven't got to the gym lately, so a little bit out of breath. But anyways, I digress. Since mid-March, careers just like mine and others in healthcare has changed drastically. I've turned into a COVID tester, honorary nurse, contract tracer, help running lab reports on COVID patients. And to all, let me stop this because this is very important, to all my healthcare workers, healthcare students, we need you. I appreciate you. I love you. Thank you so much for all that you're doing. Now we're going to go on. In the beginning, we were heroes, and now we're kind of overlooked and overworked. That's enough about me. Let's talk about something more important. Right now, I would like to ask for a moment of silence as I begin my presentation for the ones that have walked on to the spirit life. Okay, now just a quick brief history. When the Pilgrims landed in Plymouth Rock in 1620, they did not arrive alone. Their arrival and their predated discovery, along with, they had microbes and germs and disease, but these dangerous pathogens tagged along no matter where they went. Now, these new diseases threaten the survival of our Native American people. Although Native Americans' populations were equipped to deal with some massive diseases, European contact exposed them to foreign diseases that we've never seen and never existed in our humanity, or knowledge of treatment. Inside these colonies, there was dehydration, malnutrition, weakened immunity, poor sanitation, and high levels of exposure increased morbidity. The system of colonization here in the US has created and continues to create high risk factors for poor health outcomes with our Native American communities. Now, the government removed many indigenous people from their communities and land and confined us to these small reservations. In so doing that, removing us from our traditional diets and lifestyle and spiritual practices that were really essential to our homeland. Today, we, Native Americans and Alaskan Natives, have higher rates of obesity, diabetes, asthma, heart disease, addiction, suicide, more than our Caucasian brothers. This is built in perfect environments to kill us. But to all my natives, brothers and sisters, grandparents, aunties, uncles, and parents, uh, whether you're near and far, we're still here. Let me say that again. We are still here. Pre-European times, the native people had little to no disease when starting, and it has been stated that some natives have the healthiest communities before the Europeans' arrival. Now, European disease devastated entire tribes. To this day, these diseases still plague Native American communities. Let's talk about some of the diseases. It's been noted that when the Europeans came over, they brought 30 plagues and diseases with them. From smallpox in 1617 that killed 90 to 95% of Native Americans. The bubonic plague, 1620 to 1680, about 87% of Native Americans' population died in a short period of time. Chickenpox, malaria in the 1830s, measles in 1836, scarlet fever, typhoid, and the Indian Removal Act 200 years later in 1830. Now, the only reason I say this is because this is not the first time a virus pandemic has crossed the beautiful ocean blue and tried to destroy our communities. Now, today I'm going to talk and I'm going to give 3 points on what I see in our community. Now, there's been a lot of talk and a lot of other reservations that are hit harder, way harder than we are here at Prairie Bend and Northeast Kansas. Now, the Navajo Nation at one point in time, when this all first started, had more cases than New York City and California and Texas. Now they still don't have running water. So washing hands isn't possible for them unless they go to the riverbed. Now, so I digress. So we're going to start with my point number 1. In the US, there is 574 federally recognized tribes. Native tribes, urban and rural communities are being affected by COVID-19 in many different ways, from healthcare needs, economic impacts, and access to daily essentials. Let's talk about money. That's the key, is money. Our local casino, the Prairie Bend Potawatomi Nation's casino, shut down on 3/17 of 2020, like most everyone did. Las Vegas, and reopened on 6/15/2020. The first 2 weeks, which is so amazing, all the employees got paid their wages for the first 2 weeks. Well, we see that it's spreading faster and faster and faster with no end in sight. So all those employees were laid off instead of essential employees. Now, according to the NCRC, the median income for Native American households on the reservation is $29,000 a year, compared to nearly a third less of $57,000 to our Caucasian neighbors. Now, it doesn't seem 29,000, it's probably $13 an hour. Now, keep in mind this $29,000 whenever I talk about my next point. The economic impact doesn't stop with tribes, as many states and regions benefit from jobs, tax revenues, brought to you by tribal casinos and operations. In 2019, the gaming enterprise generated $17.7 billion in taxes to local, states, governments, and federal. Now, $17.7 billion. I would like to have that many zeros in my bank account, but let's talk about $17.7 billion. I did some research, and if we had $17.7 billion and we did that in miles, we could travel across the globe 710,000 times. Hey, I like to travel, especially right now. So if you wanted to take a round trip from the moon and back, you could go 37,000 times with $17.7 billion. Now, if we did this until, let's break it down even further. If we take 17.7 billion minutes and broke it down to the lifelong expectancy, you could live to be 33,000 years old. 33,000 years old, that's pretty old. Now, of those 574 federally recognized tribes, a little more than 40% 245 operate casinos, and before COVID-19, tribal businesses and governments supported 1.1 million jobs. 950,000 of them help non-natives. So when the tribal casinos closed, that really impacted the economy, because most of these tribes and casinos are actually rural casinos. And for the jobs, 950,000 of them help non-natives. There's one casino in Verona, California. Their tribal, it's a very large casino. Their tribal employee rate is 4 people. So whenever it closed down, it really affected that community, and affects this community too. So some regions, some tribal enterprises have been economic anchors and dominant employers. And Joseph Colt, the director of Harvard Project and American Indian Economic Development, have also stated the same thing on how it was a devastation that these COVID-19 has done to the casinos. Now let's talk about the generational living. That's one thing that really hurts Native Americans, is due to the lack of affordable housing, increased unemployment, which we just talked about. And remember, the household income is 29,000, but we have generational living. We're living with our grandparents, we're living with our parents, and we're living with our kids, all in one house. And that house is producing $29,000 a year for 5 to 10 people. Can't live on that for 5 to 10 people, am I right? And then you have the casinos closing down. It's not looking good, is it? Well, family structures, many indigenous people live in crowded homes, which makes social distancing nearly impossible. Now, the PVPN community is a small, close-knit community, just like many others on the reservations around America. The ones contracting COVID-19 happen through its own family members. Now, as you all know, us natives are really close, and we like to help out and help one another. We love to share our food. We love to share our stories. Staying separated is not one thing that we can do. It is not. From birthday parties, prayer meetings, ceremonies, work, and neighborhood children just playing with children, that has been the biggest spreader of COVID-19 in our native communities. If elders were to contract this virus, not only would they perish and walk on to the spirit world, the language would also too. In turn, that our communities would die. Now, let's talk about access to the food. That's another challenge Native American communities are facing, is access to food. Food deserts, which we are, it's 15 to 20 minutes to the nearest grocery store. And the grocery store is Walmart, which the prices are lower, but the food isn't that great. Farmers markets are scarce, which means there's no grocery store closer than the one we have here. The native people have sophisticated agricultural practices. We have the ability to hunt and gather, but that was all limited whenever we were moved away from our homelands and put on these 11 by 11 spaces. Now, a record number of Americans face hunger each year due to COVID-19. Now, due to COVID-19, the economic fallout, millions of people are unable to buy food. And a lot of people, have you seen the toilet paper fiasco, which is mind-blowing because it's a respiratory illness, but I digress. The panic buying right now is crazy. People are scared, they're panic buying. And if we have people that are generational living with 10 people in the home and only on $29,000, and that's not including health and bills and gas, we can't panic buy. So we have to rely on our own food, our own community. And it's hard right now. It's very hard. It brings me to tears. I want to cry right now because I see the impact it has. And my program, we have a partnership with the CDC where we could till gardens and provide seeds and food, but we weren't able to this year due to COVID. So a lot of families that were banking on those seeds and food for the fall and the wintertime were disappointed and heartbroken that we couldn't. Now here at PVPN, the closest grocery store, like I said, is 15 to 20 miles away. And that's in a county called Jackson County. Now, in early March, our governor, Laura Kelly, issued a statewide mandate on masks, which is amazing. Thank you so much. Well, 8 months later, our neighboring community finally did a mask mandate. As their numbers are increasing, they said, you know what, it's finally time to do a mask mandate. Well, and we're 8 months too late because we're having our community pass away. We're having all our ceremonies are being canceled. And now that's where the grocery store is. So during those 8 months, we would have to go to the grocery store, to the local community. They didn't have a mask mandate and you could walk around freely and bring that virus back home. Not smart. Now, having access to traditional food in grocery stores is so far, many have had risked their lives, like I said, to traveling to infected communities that didn't have these mask mandates and bring it back to our community to kill us. Now, we talk about healthcare. Having access to healthcare is a vital component of fighting this virus. Many members of these federally recognized tribes have access to IHS, which is right here, logo, Indian Health Services, okay? This Indian Health Services medical care it's been argued that we don't have the adequate technology or the doctors to meet even third world countries' medical supplies. But is it underfunded? Yes, because we're funded by the government. Those are treaties that we've signed for our land weren't upholded. Still to this day, we don't get the proper PPE. We don't get the proper funding. We don't get the proper. Just stop it there before I go too far. But the doctors here and providers and nurses here at Prairie Band are above and beyond happy to help their community because they grew up in this community. Most of our providers and nurses, they were children and they came here and they were seen here and now they're in their 60s and they love the community, part of the community. Now, some of the things that we offer here at Prairie Band Potawatomi Nation are dental exams. We're a one-stop shop. We offer dental exams, pharmacy, diabetic, nutrition, exercise classes, lab work, x-rays, ultrasounds, and so much more. All has changed due to COVID. Now the clinic's main focus is COVID testing, tracking, tracing, calling patients, and then adding that to our daily phone calls and seeing patients. All the IHS medical facilities and all the medical facilities around the world are facing exhaustion, empathy, fatigue. We're understaffed. We're barely holding our heads up. Now, I don't have our test numbers because we're unique. We have 2 rapid machines. We're able to read and get your results back in at least an hour. Due to our small community of 12 to 1,500, we're testing 20 to 25 a day with a short staff, underfunded. That puts a lot of strain. We do have 1 to 3 nurses that do the contract tracing and the calls, but that's a lot of work for 3 nurses. Now, in closing, as Native people, we've always been resilient and strong. We have values and adapted to ensure the traditions and culture of our people. Now, we will continue to be loving and compassionate people. Young people, please hear my words and please take them to heart. You may be young and healthy, but please be mindful of your elders, your parents, and your loved ones. Their immune system is not as strong as yours. They need to be protected. This language needs to be protected. Your culture needs to be protected. You need to be protected. Once again, I thank you, and I'm going to open up to any kind of questions that you have that I can answer.
So Matthew,
Yes.
thank you so much. And I was wondering if you could start just by giving us a background about yourself. I think you're really interesting and your work is really interesting. and then maybe we'll go into some more like specific questions related
Absolutely.
to your work.
So the background of myself, I'm 35 years old. I grew up in a small suburb out of Tulsa, Oklahoma. Very poverty-stricken community. It was either you work for the local tribes or you work for shopping carts. So all the shopping carts that you see wherever you're from, they come from my small town. So and on there it'll say UNARCO and Wagner, Oklahoma, and that's where I'm from. So
Oh,
next time you look, yeah, you could think of me. So it was either work at those or go to school. We had some great universities: Oklahoma State University, the University of Tulsa, and I'm not going to mention the other university in Oklahoma, but they're great universities. I wasn't able to get into any of those but one, and at that time I moved away and moved to Kansas to start over. And when I did, I studied health and nutrition, kinesiology, you name it. I've done it. I was an assistant strength and conditioning coach for the University of Kansas in my time from 2010 until 2013, working with softball, football, basketball. Worked with a lot of amazing athletes, worked with a lot of amazing coaches. And then I decided it's time to get into the health realm so I could help a bigger population than just athletes. And lo and behold, here I am. As a child, I grew, like I said, poverty stricken. Obesity was a really big thing. Battle ADHD. But here I am helping others. There's no one else to help them that can relate to them more than I can. So here I am.
Well, and when we made contact, you sent some of the links that of you, because you're featured on the local news like pretty regularly. Can you talk a little bit
Yes.
about that? It's
Yeah.
very
So what I
interesting.
do is I started a partnership with our local news station. Brittany Moore, she's no longer here, contacted me because I have these awesome bikes that I do fun interactive smoothies and
Yeah.
things like that. It's just a big party. And she was like, "You're great. Come on the show. I love your energy." So we built a friendship, and I've been doing that every month for the past year or two. And I just booked my next gig on December 31st, talking about the new year, new you, all the things that come with that during a pandemic. So yeah, I'm high energy, going all the time. Not a lot of people can handle it.
We'll share some of those links when we send out our information after today's talk so people can see your smoothie recipes. I think they're amazing. You know, everybody likes good nutrition, good food, things that taste good.
Absolutely.
And your
And we
presentation.
make it fun. That's the
Yes.
thing is exercise, nutrition can be really boring. It can be heartbreaking. It can really tear you down. But if we make it fun and interesting and mold it to what you want to do, then sky's the limit.
And so for you, what connection is there between like the nutrition and your COVID-19 patients? Has there been any connection at all from that expertise to the current virus?
Well,
Have you
thank you for the
seen it?
question. We're actually doing a study in-house. I'm leading the study, and we're looking over how COVID-19 has affected some of the patients. We're taking BMI, we're taking income, we're taking hospitalizations all into account when we do this study. Not so much a study, but we're watching them for the next 2 to 3 years. We had one patient that had COVID, and now they're on insulin, which really destroyed the pancreas and insulin. And they weren't diabetic before, but now they are.
Mm.
So that happened with all in 2 months.
Oh my
But
gosh,
as for
that's
nutrition, I
interesting.
think for nutrition wise, I think it's to our community specifically, it's getting back to the traditional foods, the growing your own foods, the corns, the squashes, the traditional medicine to help fight COVID-19. Now, with that, it comes accessibility, and that's something that we don't have right now.
We had a good question in the chat. Aaron, you feel free to take off your unmute yourself and ask the question yourself if you'd like.
Okay, yeah. Can you hear me okay?
Yeah.
Okay. I was wondering if your tribe and other tribes get any federal dollars to help with income shortfalls. And I'm thinking non-COVID times, just regular times.
So non-COVID, that's a great question. Thank you so much for the question. So the income, let's talk about non-COVID funds from the government. This tribe, most tribes, depending on the revenue from the casinos and other economic revenues that they have a per cap that is distributed to the community, depending on blood quantum and enrollment. This tribe does receive per cap. Now, the big component to getting those funds is from the casino. And if the casino's closed, you don't get that money. Now, the HEROES Act, Article 608, I believe, I don't know if it's been passed or not, but that was $40 billion supposed to go to tribal people. Now that's 574 recognized tribes, and that money was supposed to go to the people, but I have not yet seen it here. We got some of the CARES Act, and it all depends on who and where you are, because our facility is really, really good, and we have the capability of grant writing and getting the grants, and we got some CDC grants and CARES Act grants, and that we produced to the community in shortfall of the casino closing down. And that was a big component to that, but not a lot of tribes can do that. They're not equipped for that, so they suffer. Hopefully I answered your question.
Matthew, kind of connected to that, I was curious. I don't know a lot about the Indian Health Services. It just, I think maybe 2 years ago during Native American Heritage Month, we watched a documentary that kind of addressed the Indian Health Services and the agreement between the United States to provide certain numbers of dollars, which has never happened and continues to not happen.
Right.
And so I'm curious, like in a situation like COVID, are kind of to what Aaron was saying, is there money that you get from, the US government specifically for healthcare? Or does it all have to come from Indian Health Services? Like, are they completely separate, or is there money that funnels in regularly or in an emergency for healthcare?
Okay, really, I could go on and on and on and talking about this because there's so many different avenues. But the way this tribe works is we are IHS, but we're a tribally affiliated. We run our own.
Okay.
So we can charge patients and do co-pays for non-tribal members. So if you have lineage or you're married to a tribal member, we can actually charge a copay and make money that way. But we do get funds. There's some that come from IHS directly, like my position is directly funded by IHS that gets money from the government. So it trickles down. There's some that goes from IHS just to us, and there's some that comes from the government just to the tribe. It just depends on what avenue we're going for. But health-wise, it's supposed to all come from the government to IHS to us, and it's been lacking for about 200 years.
Yeah, I know
Just
there are a lot of issues. No, there are a lot of issues. I can't speak specifically because I'm not educated enough, but just watching that film, it kind of brought up some awareness of the lack of funding issues. You talk a lot about the casinos, and this is an area, again, that I have no knowledge, very little knowledge of, very, very little, just kind of passing knowledge that there are casinos. And you talk about you mentioned a number, I think it was like
17.7 billion.
That's generated, by the casinos. So,
yeah.
So how does all of that go to the tribes and to
Absolutely not.
Okay.
So the 17.7 billion that we talked about was just like the taxes that we revenue that we give back to local governments, federal and state. That's how much all the casinos in the United States, the Native American casinos, produced just the year of 2019.
Yeah, that's a lot of money. So you're actually, that's money you're paying back in taxes?
Absolutely.
To what government? To the...
It could be local governments. It could be
the
state governments, federal government, and mostly some charities, things like that. Because this tribe, the Prairie Band Potawatomi Nation, actually donates a lot to the community. We provide jobs to the Boys and Girls Club. We provide events. We provide schooling. We provide laptops. There's so much that we donate back to the community. Like right now, we're having a hard time because we're set in a rural area.
Mhm.
So homeschooling, internet isn't available. So the tribe is working with other avenues with the Boys and Girls Club to produce these wireless hotspots to help them. But
Right.
it's really tough in a rural area.
Yeah, internet access became a
Right.
real issue during COVID with people having to be home, and even when, like especially rural, I realize it can be real challenging.
Absolutely.
Um, I would like to ask our audience if anyone has a specific question, you can unmute and ask Matthew. He's very easy to talk to. So community conversations is a conversation. And so please feel free to jump in. It's very informal. And if you are shy, you can definitely put it in the chat box.
I have a question, Kimberly.
Please.
Hi, thank you for this talk today and opening it up to the campus community. My impression is that there's a strong tradition of art and music in Native American cultures. And I wonder how you see the pandemic playing out in art and music, either now or in the near future, in documenting this time.
Ooh, that's a good one. I would have to ask one of my elders on how they see that. I can't answer that, but that is such a great question. I see a lot of, man, I can't even answer that because our main thing is getting together and having powwows and music and art, and we can't do that right now. So we're doing everything virtually. So I man, Trev, that's amazing. I can't answer that honestly. I don't know what it would look like or how it's going to look like, but I know it's hurting our people now.
Yeah,
Did you
it'll
say
be
they
interesting to
don't have
see if
internet?
it comes out in tapestries or chants
Right.
or art. Yeah, thank
Yeah,
you.
that's awesome. Thank you. So are you Charlotte, are you a big art person, music person yourself?
Maybe in not a very in-depth way, but I like to just see different things and see how different people express themselves. So
No, how we do now, right now, is we do mostly, like I said, we do online, but we have drummers that drum online for healing. We have dancers that get in full regalia to dance, just to have some of those healing moments in that music, because the drum is our heartbeat. And that's exactly what it is. We need that heartbeat to stay alive. So if we're not doing it, then we perish and walk on. So we can't stop just because of this virus.
Mhm. So you are holding some of your like spiritual ceremonies virtually, and your healing ceremonies, Matthew, is that correct?
Well, I can't speak 100% on those because I'm not part of the spiritual aspect, but they are being held. And like I said earlier, that's some of our major COVID-19 spreaders, is those gatherings and those families and multi-generational living that we continue to do. But we try to push different avenues. We try to push online avenues of saying, but then again, this is spiritual, so this needs to be private. So that's a big thing for us.
I had a question for you, Matthew. You mentioned your nurses calling people for contract tracing. Are they able to keep up at all? Or I asked because I recently got a call that I was in contact with someone and I was told I don't need to quarantine because the time long has since passed, but they still, gave me the call. I'm just curious how that works.
Oh, thank you for the question. And sorry you were in contact with somebody that had it. Hopefully they're doing well. It's just a thing that we're going through. It's not a matter of when or how. It's just a matter of when we'll all get it. It's right now. I was checking in with our nursing staff this morning, and we're about 37 patients behind due to short staffed. And mind you, this clinic only has about 30 to 50 employees, and we only have 2, 4, 6, 7 nurses.
Oh, thank you.
Yeah. And we're testing 20 to 25 a day with only 2 lab techs, me as a tester, someone as a runner, and then 3 nurses that call back. So it's quite a bit.
So I have a question relative to your clinic, and this may or may not be relevant for during COVID, but do you allow for like students or residents who are looking for diverse clinical rotation experiences? Do you allow them to do a rotation and come and learn and spend time at your clinic? Because I know I get that question a lot. We're responsible for organizing, um, we call them international educational experiences, so where our students or residents go out of the country, but we also have an interest from students of, you know, because it is a cultural experience as well, joining with a tribal clinic. So I was wondering if you know, are those opportunities available? You know, do you see that at your clinic? Is it, you know, is it a burden, too much of a burden for your clinic to host students and residents?
Absolutely not. We'll take anybody,
Will
especially
you?
right now.
Oh, okay.
uh,
Okay.
no, our pharmacy, they have KU students that rotate every 3 to 4 months.
Okay.
Nursing, we don't have enough nurses, so we would love to have nurses. And if you have any students that are interested, that you can give them my information and we can talk. But no, we would love to have anyone that wants to help our community. And then once they're here, they're family, so they'll always be a part.
That's fantastic. That's a really important part, I think, of an experience when a student or resident goes into a new community, is feeling like they're welcome, and that, you know, that people that it's okay for them to be there. And we look for that when we're placing our students. So I like to hear that.
And they are. This is why I've been here for 10 years. Is I did one stint here and I was never leaving.
You're like, this is home. This feels good.
Exactly.
Yeah. So tell us about the work you do relative to diabetes and health and wellness and nutrition during COVID. Are you still able to run your programs? Do you do it by Zoom or virtually, or how do you do exercise and coaching and stuff during this time?
Well, Kimberly, that's a really tough question. But we do. We are staffed with myself, a lifestyle coach, and a nurse. That's the only 3 staff that we have to patient for our 336 patients. So that's a lot of work for us to do. Not only community events, exercises, water aerobics, chair exercises, nutrition classes, cooking classes. It's been a 3-person show for all of us. So we break it up in the morning time. We go see our COVID patients, or we do our testing, and then in the afternoon, it's all diabetic, nutrition, cooking, producing stuff online. Everything's online. But then again, reaching patients is tough due to the rural area, no internet access. Last week, I did a live DJ sets. I do a little DJ music on the side, and we had a dance party. So if you could tune in via Facebook Live, we played some great music. We had worked out a little bit. You watched me DJ, and then that was the weekend. And then we post recipes daily. We have a podcast. It's called the Healthy Lifestyle Podcast, where we talk about just normal things on how to buy diabetic friendly shoes, how to go to the grocery store, how to coupon, what you should keep in your cabinet, what kind of exercises you're doing. We talk about fad diets. We bring in doctors, practitioners, nurses, but within our clinic. But COVID has really hit us hard with that because we're active, very active in the community.
So I have a question. Thank you, Matthew, for your time today. I was wondering how the trust level, or perhaps mistrust level, of Native Americans has been impacted by COVID. I know that a lot of Americans have been distrustful, especially around this time, regarding how the government and healthcare leaders are approaching healthcare with COVID. So I was wondering if there has just been an increase in that distrust among the Native American populations, especially due to some of the history that has occurred.
That's a great question. And what was your name?
I'm Jennifer.
Jennifer, thank you so much. So Jennifer, to answer your question, I'm going to answer in like many different parts. Like I said, I battle ADHD real bad, so we're going to go around in circles. So with historical trauma, you know, it is genetic. Historical trauma is genetic. So we we don't like the government too much, really, not honestly. And I'm gonna get to your question, I swear. Um, right now, I'm gonna get off topic and we're gonna talk about uh, the vaccine. Well, we've heard that the government wants to send us natives the vaccine first. Don't want to do that, with history and things like that. We don't want to be the guinea pig for this. We just got word last week that the IHS and the government have kind of made a deal where they're going to give us the first vaccine. Not really trusting with that. But us in the community, we trust, we love anyone that's going to come help us. So I think we're pretty trusting. We'll still be there. We'll still help out. You've done us. They've done it. The government has done us wrong for so long, but we're still here helping out. We serve in the military. We donate our time. We donate our health resources. We donate our food. We donate everything, and we're still here helping.
Yeah, absolutely. Thank you for sharing, Matthew. I think that's really important. We're seeing this increase of even Americans just being distrustful regarding this vaccine and who gets it first and who's willing to even get vaccinated. So, it's always interesting to get a perspective from Native American populations as well, just due to that long history. So thank you for sharing.
Thank you, Jennifer. I appreciate that.
Matthew, something you said reminded me. I don't know if you saw the article, and I'm not always great with facts, but there was an article about a relationship between Ireland and one of the Native American heritage groups, where
Yes.
Did you hear where in Ireland, they were sending money here, and it was to pay back for the money that the Native American population had sent to Ireland during the Great Famine, potato famine. Did you read that article?
I did. Yeah, we talk about that to this day still. My wife is half Irish, and she lets me know that all the time because she's half Irish and half Native. And actually, in Ireland, they have a statue of a beautiful Native American dancer in regalia that's in honor of the help that we've sent to them during their famine.
Yeah, I think that's such a sweet story, and it really speaks to what you said, is you're always here willing to help, despite historical events with the government and the people. There seems to still be that people to people, relationship, and willing to welcome people into the community.
Absolutely. Like I said, once you step on our reservation, your family. As long as you can help us out and we can help you and love one another, your family.
Mm-hmm. One other thing that you said that really resonates with me. So I'm Irish Catholic, and we have a really big family. So we have 9 children, so 11 at home. And so this whole social distancing was really impossible for us during COVID. And yet, we don't get to spend as much time with our extended family, which is really also important. So like this week, we can't get with my husband's brothers and his family for Thanksgiving. So it's this interesting dynamic that occurs. We always feel like we're a community outbreak about to happen just within our own family, because we have kids at I think it's 7 different schools, so you think about the contact. But I think that I understand that element that you were talking about with big families, and it's really hard to contain exposure when there's just so many people. Even if you're wearing a mask when you go out in public, there's just
absolutely
so much exposure.
Yeah, the generational living that we have with the grandkids living with the parents and the parents living with their parents and possibly their grandparents. And our housing situation, all Native housing situations aren't the best. Poverty stricken, hardly any water in some reservations, no access to really good health care. That can really play a lot. And you having a large family, a lot of people out here do too. And family is very, very important. And during this time where you can't go visit family, or you're not supposed to go visit family, and that really takes a toll on the mental health of patients.
I was going to ask, what have you seen relative to that, the mental health, the people just dealing with COVID relative to the isolation?
COVID fatigue, COVID burnout, mental health. As you know, the Native Americans also battle addiction. So that's the other thing that we got to be mindful of is if depression hits, are we going to go to alcohol, drugs, or are we going to go to anything else? So mental health, making contact with the patients, talking to them, community members, just like our little events that we're doing online. Hey, reach out. We're here. Call us. We might not return the call back because we got to call 47 more patients, but we're still here for you. Just checking in, email, anything.
Do we have any other questions from anybody? Dr. Glenn?
Yes, I have a question. Matthew, thanks for that presentation. It was sobering, and we've heard, a lot of those statistics, but it's really powerful to get it from someone on the front lines within that community. And I wanted to know if you could outline kind of what you feel would be a long-term plan for Native American sovereignty within North America. Whereas, one of the possible projects that we have going on right now in terms of anti-racism education is called the Repair Project. And we're asking, for institutions to think about what it would mean to repair the harm and damage that has been done, to communities over the past centuries. And I wonder if you could sort of outline, your own vision for that, for your own community and for similar communities, in terms of what would it take, to kind of repair and have you all have, some sense of sovereignty and command over your health and your food resources and the way you live, all of that.
Well, Dr. Glenn, thank you so much. And I really like your painting in the background. What is that of?
That's Bootsy Collins of Parliament Funkadelic and James Brown.
All right, man, I like it. So one thing that we really need is communication from the government. Honest communication. Hold to those treaties that you promised us years ago. More funding. We need better equipment. So some of the things we want to do and need they are ever changing. So what I really think, and this is just my perspective, now you could ask someone that's lived here their whole life. I've only been here 10 years, so I can't really speak on much. I can just speak on what I know for the past 10 years, is access to better food. We need to have our own grocery stores. We don't need fast food. We don't need these convenience stores. We need health food. We need traditional food. We need access to better equipment in our health centers. Those are the main things for me. We need our own education. We need schools that could teach our heritage, the nation's heritage and the language. That's what we need, and that's what mine would look like: is schools, food, and health. If that answered your question.
Yes, thank you.
Thank you, sir.
And I hope it's a conversation that, we can continue having in many different venues. Out of all the vulnerable people, in the US, Native American communities remain, one of the most vulnerable. And, I appreciate the way you're able to lay it out with humility, a little Black humor too at the same time. I know it must be difficult to talk about.
It is very difficult. It's a little bit easier for me to talk about because I'm an outsider looking in. But if we had someone that's spent their whole life here and seen everything, then it would most definitely. It's heartbreaking. It's so heartbreaking to hear the elders talk about how they were treated, not getting the right to vote until the 1960s, even though we were the first people here. It's really tough. Our voice has never been heard, just like many other races.
Dr. Glenn, I really appreciate your question, and Matthew, your, talking about that, because I realize from one of our other events from Native American Heritage Month, Dr. Rachel DeTeresi said that what she feels like the community needs is more allyship. And that speaks to what you were saying, Dr. Glenn, as far as being one of the most vulnerable populations, and also smaller, like a minority of minorities. It makes me wonder, like, relative to some of the treaties and such, like what we can do to hold our government accountable for those promises and come through still today. I don't think it's something that we have to say, well, we haven't done it, so why do we do it now? I think it's more like, we haven't done it, what can we do now? And so I love that connection to the idea, Dr. Glenn, of the Repair Project. How can we continue these conversations and truly be allies in what needs to be done today and moving forward? It's good stuff.
Matthew, so my sister also went to Haskell. Sorry, I'll tip my camera on. And I know that there's not a lot of degrees in like the health professions that are offered. And I think it's like weird how KU is right next to Haskell, but you can't even take joint classes like pre-nursing or pre-med courses. And yet our School of Medicine wants to help. I'm in the School of Medicine, but wants to help recruit more Native students. But it's like, how can we get more people in the health professions if we don't even have access, even in Lawrence? So like, that was one thing. My sister ended up transferring to another school in, it was Fort Lewis in Colorado, because they have a good Native program. They had a little bit more degree offerings. But how did you get your degree? And like, what could we do like to try to push for more health pre-profession degrees at Haskell? I know it's hard because it's federally funded, but I don't know.
No, sir, that's a great question, and that's awesome that your sister went to Haskell. Onward Haskell, appreciate that. The things that how I ended up is I just got my associates in health and exercise science and moved on to Washburn and moved on to Arizona State and got massive in debt. But it's a hard thing because you, just like you said, it's fairly funded. We did have a bridge program when I was there in 2010, 2011-ish, I think so, where we would exchange Haskell students for some KU students in the American Indian Studies, and then we would do it that way. But I would like to see more health classes. I would have stuck around and got my degree, or my bachelor's, or I wish they had a doctorate's degree. I would have stuck there for sure. But yeah, I agree with you. How can we make that happen on federal dollars? Do we ask for tribes to donate money to get degrees? Do we, yeah.
I know, it's tough. It's like crazy, like just, yeah. Anyways, I'm not even gonna talk about, but you know,
exactly,
with a lot of things, like in the state, it's hard because like, so we're talking about like state and local governments, you're right, being allies. My family, because I'm Muskogee Creek Nation, I'm a member of Muskogee.
Hey, all right.
And part Osage, but I'm not with like, I'm not enrolled in the Osage tribe.
Okay.
For like long history story, but I have a couple of relatives who worked in the casinos, and because of like the lack of mask policy, like both of them contracted COVID and unfortunately like passed away because, like you said, multiple comorbidities, diabetes, obesity. Of course, like most of my family has either type 1 or type 2 plus hypertension plus hyperlipidemia and COPD, because they probably, well, the two relatives, one of them smoked, but like, yeah, it's like a whole bunch of things. And it's just frustrating because it's like they had to work to get money, but then people weren't really wearing masks in the casino because it wasn't mandated. And then like they get sick. And then even at the funeral, my mom couldn't go and we didn't go because of COVID. But the funeral, like the guy at the church, the priest, he took his mask off for a second to speak. And it wasn't on purpose, like he was far away in social distance, but it's like, that's the state, you know, like the state policies kind of enact that if other people aren't wearing masks around you, you're going to be like, oh, it's not a big deal, I'm not going to wear a mask. It's just so frustrating. That's all I'm just going to say. Like the government sometimes works counterintuitively. Obviously, you guys have seen the structural institutions that perpetuate these problems, but it's just like really frustrating. That's all. And I wanted to say, I really appreciate your talking and I appreciate the work that you've been doing and everything. So thank you.
Well, Sarah, I appreciate you. Thank you so much for tuning in. And I know exactly where Muskogee Creek Nation is. I grew up not too far from there. Great people. So with that, mask work. they work. I test every day, and all the nurses here, all the people that work in hospitals, they wear their mask. And guess what? There's no big outbreak. They work. They work. I have yet to be tested or signs and symptoms in 8 months. They work, and that's what we need to preach. And but then again, Oklahoma isn't the best at listening, I guess. But my home state, they kind of want to do what they want to do, you know.
Well, Matthew, I don't know if we have any other questions. We're right at the getting close to the 1 o'clock hour. Anybody have one more question for Matthew?
Yeah, ask anything. It can be from my life in Oklahoma. It could be college. It could be health, whatever. Nutrition, ask away.
Okay, Matthew, I have to ask you. I've been dying all hour to ask you about the ring that you're wearing. Is
Oh, it's my wedding ring.
No, the other
Just
one.
kidding.
The big.
Just kidding. So I have a patient that I grew up a big Kansas City fan, and they wanted to. I got their numbers right where they needed to be, no longer on medicine, and they actually gave me a copy of the Super Bowl ring. So that was kind of like a thank you for getting me healthy and active. And this person, mind you, is in a wheelchair, and now they walk and they swim, and
That's
they
fantastic.
they couldn't get into the floor. Now they're out of the floor. They're walking and doing push-ups against the wall. And yeah, it's
Okay.
became my grandma. She's my grandma now because we built such a strong relationship. But yeah, that's exactly what it is. It's a
It is a replica. It's a big ring. And I was like, okay, so he either was on a national championship team in college or something, or
No, I hate to say it, but whenever I was playing sports at high school, we didn't win a lot of games.
That's okay. That's all right. Hey, Matthew, it's so great just getting to know you a little bit. And I know we've exchanged some emails, and that's been fun too. And I really look forward to continuing, like Dr. Glenn said, continuing the conversation. I hope you feel like you're part of the KU Med community now, because we feel the same way. Like, we want to welcome you into our community, and beware, we will use you, you know.
Absolutely. I'm always here, and especially bring the funk, Dr. Glenn.
Oh, it's been fun. It's been informative. We really appreciate you, Matthew.
Thank
Appreciate
you.
your time, appreciate your knowledge, and we look forward to engaging with you again. So thanks to everybody for joining today for our community conversation. We hope to see you all tomorrow noon. We have Representative Ed Davids on at noon. So if you haven't registered, please go to our website and do that. We'll see you tomorrow. Thanks,
Bye, guys.
Matthew.
Thank you so much. Have a great evening.
Tomorrow too. You can join to listen to Representative Davids if you want.
Love to.
Great. Talk to you later.
Thank you so much.
Bye.